Welcome back. When it comes to prescriptions and medications, you want to make sure you have the right insurance to cover you for what you need. I'm joined now by Danielle from our sponsors at Univera Healthcare, who oversees Medicare formularies. Thank you so much for coming in, Danielle. How are you?
Hi, good. Thank you, Chelsea. Nice to be here.
I would like you to start off by telling us about what a formulary is and what you help members with.
Great. A formulary is really just a fancy name for a list of covered drugs that a plan will cover for you.
Okay, nice.
Yep.
Easy enough. Can you walk us through some of the important drug coverages changes that are coming up next year?
Yes. First, we have to start with the Inflation Reduction Act. It was passed in 2022, and it was intended to reduce the deficit, but had a lot of health care provisions involved in it. A lot of the plans, or a lot of the provisions affect Medicare Part D, which is your prescription drug coverage.
Okay.
So some of the enhancements that have already occurred the last year and a half include vaccines for adults that are recommended by the Advisory Committee of Immunization Practices are of no charge to any Medicare member. So these are Part D vaccines like you would get for shingles or RSV. So members will pay absolutely no cost for those.
Okay.
One of the other ones is secondly is insulin. Whether you inject it with a syringe or pen or use it in a traditional insulin pump, it is capped at a $35 cost share per month supply. So no more of these $100 massive bills at the pharmacy.
Right.
Second, for this year, members are seeing that there's absolutely no cost share in the catastrophic phase of their benefit. So once they've reached that catastrophic phase, they pay nothing when they go to the pharmacy.
Wow, that's huge.
Yeah, thank you.
Okay, because we know that going to the doctor and getting those prescriptions sometimes, especially as we get older and we have more prescriptions, they start to add up.
They certainly do. Yeah. What we're working on now for 2025 is actually the first ever maximum out-of-pocket for Part D drugs. This has never occurred, so there'll be no more coverage gap. And when members will go to the pharmacy, the most they will pay in a calendar year is $2,000.
Wow, okay. Yeah. Now, are these changes for all Medicare members or just those with Univera Healthcare?
They are mandated for every Medicare member. Okay. And that's whether you get your prescription plan through the health plans directly or if you happen to get it through your employer group.
Now, $2,000 is still a lot of money for some people. So what are the options for people who will reach that max amount quickly?
Great question. Next year, starting on January 1st, is the first ever Medicare Prescription Payment Plan, or M3P, we call it. What that does is it allows members to budget their prescription costs over the rest of the calendar year. So this is extremely helpful for people who have high-cost specialty drugs. They go to the pharmacy in January, they'll hit the $2,000 right away. They're allowed to budget that $2,000 over the rest of the calendar months. So what happens there is that the pharmacy won't charge them, but on the back side, the health plan will send them a bill in budgeted installments.
Okay, so it just makes it more manageable for
Yes.
people. Now, do you have any tips to help save Medicare members money on their prescription?
Oh, yeah. We have 5 ways to save. First would be to ask your doctor for a lower cost alternative. See if there's one available. Second, getting a 90-day supply will usually help save you a copay or two. Using a preferred pharmacy would also be another choice. Sometimes you have a lower copay when you go to the preferred pharmacy.
I see.
We also you can possibly see if you're eligible for extra help through the federal government and Social Security, or New York State residents can see if they're qualified for EPIC. And lastly, you can always call the Univera pharmacist for a free medication review, just to make sure that you're not overpaying on your medications.
Nice. So, Danielle, do you actually work with customers or clients at Univera?
Yes, I do.
Just kind of let them know what resources are available for them?
Oh, yeah. Everyone can call. If you're a Univera member, you can call the number on the back of your card. But there's pharmacists here to help. Because I go over all your medications. They can explain some of the new provisions that are going on. And hopefully help you save some cash.
Alrighty, you've given us some great tips today, Danielle. Thank you so much for your time.
Great.
Viewers, if you want a free medication review from our sponsors at Univera Healthcare, just call the 1-800 number right there on your screen. Thanks again for coming in, Danielle.
Thank you very much.